Hi everyone, I'm Dr. Muyoka. Welcome to Retracing My Africa in the Diaspora. Karibu sana. If you're new here, please feel welcome. If you're a returning subscriber, asante sana for electing to return. Guys, in today's video, I'm going to be talking about tuberculosis. And I am basically doing this presentation majorly for individuals who are looking to migrate to the United States of America. By now, if you're one of those people, you should know that you will be required to go to the International Organization for Migration for your medical examination. And that is going to be carried out by a physician, a medical doctor that has been appointed by the United States government. They are often referred to as panel physicians. So in today's presentation, guys, I'm going to be talking about tuberculosis, like I said, and I must start with that. I must start by saying that I am not a medical doctor. That's my disclaimer. I'm just interested in how health and migration integrate, most especially when we talk about migrating to the United States of America. So I've been doing some digging, I've been reading around, I've read notes, I've done research, looking at what the World Health Organization, the Centers for Disease Control and Prevention, the Lancet, and other institutions that do research around infectious diseases are saying with respect to tuberculosis. So that's my standpoint. I'm not a medical doctor, but I'm here to educate us all based on what I have found. Okay, and you may find this information interesting, guys. So I'm going to start by sharing with you statistics from World Health Organization. Guys, did you know that in 2023, a whopping 10.8 million people ended up infected with tuberculosis? It is serious. So many people around the world have been infected with tuberculosis, and tuberculosis is highly infectious. It is serious. So there's so much to unpack. I'm going to begin by telling you what countries have the highest numbers of individuals with tuberculosis. 5 countries. Just let me look at my notes so I don't mislead you, but I can tell you for a fact the top #1 country is India. Most of the countries I notice, they are populous countries. They're countries with high population, very high populations. So #1, India, #2, Indonesia, #3, China, #4, the Philippines, and #5, Pakistan. Okay? In Africa, the 3 countries with very, very high disease burden: DRC, the Democratic Republic of the Congo, all right? Nigeria, South Africa. Those are the 3 countries that I came across in my research, yeah? So now, guys, it's looking like Asia and Africa has the highest disease burden of tuberculosis. It's very serious. In the United States of America, the disease burden is not that high. It's actually low. Yeah, I was looking at some statistics from, I want to say, CDC, the Centers for Disease Control. They're saying that in 2023, the cases that they came across in all 50 states totaled up to 9,615 cases. You see, so it's not very significant when you compare with what's going on in places like Asia and Africa, obviously. Yeah, and we'll talk about this. So I just wanted to give you a rough kidogo statistics here and there before now we talk about tuberculosis. So let me begin by saying, as I mentioned earlier, that tuberculosis is a highly contagious disease. It's infectious, meaning that somebody who has it can easily transmit it to you. It's airborne. If they cough, sneeze, or even spit close to you, you could inhale these germs and end up getting the disease yourself. Okay? And then I'll just give you some. So it's spread through sneezing, coughing, spitting, even laughing, singing, anything that would create an opportunity for the droplets to come out of one person through the air into another person. And when somebody coughs, this bacteria will linger in the air for long hours. So if you're in an enclosed space, for example, you could easily end up being infected if you're in close proximity with an individual that is infected with the disease. Yeah. So now let me give you the symptoms of active TB. Active TB is where you're symptomatic, you're presenting with symptoms, you're not feeling well. You will have a chronic cough, which may last up to 3 weeks. And you may also cough up blood or cough up sputum. You may feel weak, fatigued. You may have loss of appetite. You're losing weight. You're having fevers and chills and night sweats, that kind of thing. And you're having pain around your chest area. Those are the symptoms. And then I also found out, guys, that there's something called latent TB. Now, in the case of latent TB, you were in close proximity with somebody who was infected, they coughed up germs, you ingested the germs, but you never fell sick because your body is very strong, the immunity is strong, so it's able to contain these microbes, and so they're not spreading and multiplying in your body to cause illness. So it's called latent TB. It's also just, it's dormant. It's in your system, it's not spreading, it's not making you sick. Okay, so that's latent TB. So you have latent TB where you're asymptomatic and you're not presenting with symptoms, you're not infectious, and then there is active TB. Okay, so I've explained these two things. Now, guys, it's very important that if you have tuberculosis, you seek medical help, medical attention. If you suspect that you have tuberculosis because maybe you went somewhere and interacted with a person that has this infection, you need to see a doctor and get treated. Now, I want to share with you places where you could easily get infected with tuberculosis, guys, so that you know if you're looking to apply to go to the United States of America, you avoid certain spaces or situations that could lead to you becoming vulnerable to infection. Okay, I kind of wrote this on my notes. I don't know if you can see, guys. Yeah, but you could get infection if you go to hospitals, especially if you go to hospitals where you have a lot of patients and a lot of crowding. Okay, you could get infected. Also at restaurants, especially restaurants where it's not properly aerated. You know, if you're not sitting outside where it's in the open, you know, or you're sitting in places where the windows are closed and there's a lot of crowding at a restaurant or a hotel, that might be a problem. Also in prisons, or if the police stopped you at a traffic stop and said you have committed a traffic violation and say they're taking you to the station, okay, and throw you in the cell where there's lots of people there, you could get TB there. Yeah. And then also if you're using public transportation, that's a problem. And lastly, if you are living in a slum area, that can be a problem as well. Yeah, so what can we do, guys? What can we do? If we are, those of us living in Africa, if we are already susceptible, maybe because we're living in informal settlements, or we use public transportation where there's a lot of people in the buses, you know, some people are coughing, you know. Now, number one, you need to make sure that if you're in a public transport, okay, open the window, let some air out. That's very important. Then also remember, guys, to use a mask and wear it properly like that when you're going into the public transport or in crowded spaces. It's very important. Wear this. Even when you're going to see a patient at a hospital, put on this. It will protect you. It will help you stay safe. And if you are not feeling well, went to the doctor and you are diagnosed with tuberculosis, guys, remember to complete your medication. It's very critical. If you don't finish taking your meds, guess what will happen to you? You will relapse, you will become sick, and you could die of the disease. Yeah, it's very serious. Guys, I found out from reading, just doing this research on tuberculosis, that majority of people who get infected are actually adults. 90% of cases are adults. You know why? We really don't have anything to protect us. Those of us who were born and raised in Africa, we got the BCG injection. Remember, guys, most of us have this scar. I don't know if you can see my scar here. It's right here. It's BCG scar. I was injected as a baby to protect me. It's a BCG vaccine to protect me from TB. Unfortunately, this vaccine wanes over time. It weakens over time. So by the time you become an adult, it's no longer providing you any protection. Even though many of us believe that we are protected from that vaccine, we are not really protected. What is protecting us is our immunity, our body function, our proper body function. So it's very important for you, like I said earlier, to protect yourself, but also eat well. Eat well and take care of your body so that you don't get sick, because if you get sick, then you become more vulnerable. Yeah, and also watch yourself. People who have HIV, people who have cancer, people who have diabetes, people who have who are undergoing certain medical procedures, like maybe an organ transplant, those sorts of people who are even using certain medications that suppress, the body's immunity. All of these people are at more risk, a higher risk of getting this disease, the TB, the active TB. So it's very important that if you're a healthy person, you try and stay healthy. Eat well, exercise, sleep well, sleep long enough to get well rested, and avoid stress by all means. And another thing I wanted to share with you guys before I end my presentation is how important it is for us to also wash our hands, guys. Me, whenever I come home from my business out there, I always make sure before I do anything else, I will go to the bathroom, get soap, and then I start washing my hands. If I've been out and about, number one, that's what I do. Yeah, so this is usually typically me. I don't like just getting into the house, start touching things, start trying to eat a snack or a fruit or food before, I wash my hands. I make sure that I wash my hands thoroughly. I scrub them thoroughly, like so. Then, when I'm done, I can use a paper towel or a napkin or just whatever, a towel, yeah? Do that, yeah? And then properly dispose of it. Yeah, that's what I do. So I would encourage you guys to do the same so that you stay safe. Don't get TB, because if you get TB, guess what will happen? If you go to IOM for your medical assessment and they establish through the x-ray, usually they will do an x-ray. If they establish through an x-ray that you have tuberculosis, they will write it on your medical report, which is going to be sent to the US Embassy. And once they do that, when you go to the US Embassy for your interview, they will not be issuing you a visa until you have undergone treatment. And that treatment takes very long. It takes between 6 and 9 months. So the chances of you getting that visa and going to the US on your green card becomes very minimal. You don't want that. So do your very best during this period to stay safe. Yeah, like I said earlier, just a reminder, use your mask, okay? Use your mask, clean your hands, and if you're already sick, take the required medication, all right? I hope you found this video useful. Please consider subscribing to my channel if you haven't already, and please give it a thumbs up if you liked it. Thank you so much. Until next time, it's goodbye.